महामारी के बाद के दौर में बढ़ते तनाव, चिंता, अवसाद और शहरी अकेलेपन के बावजूद देश में मानसिक स्वास्थ्य के बारे में जागरूकता की कमी है। बेंगलुरु के अग्रणी मानसिक स्वास्थ्य संस्थान मार्गा माइंड केयर ने गुरुग्राम में नए सेंटर के लॉन्च के साथ उत्तर भारत में प्रवेश किया है। मार्गा माइंड केयर विज्ञान पर आधारित सहानुभूतिपूर्ण एवं जीवन शैली के अनुकूल देखभाल लेकर आया है, जिसे मानसिक रोगों से जुड़ी सोच को बदलने और गुणवत्तापूर्ण इलाज को अधिक सुलभ बनाने के लिए डिज़ाइन किया गया है। मार्गा माइंड केयर को यूएस एम्बेसी के साथ पैनल में शामिल होने वाले निजी मानसिक स्वास्थ्य सेवा प्रदाता और पूरे भारत में कैनेडियन एम्बेसी के भरोसेमंद पार्टनर होने का गौरव प्राप्त है। अपने सिग्नेचर क्राइसिस टू रिकवरी एंड बियॉन्ड मॉडल से युक्त नया गुड़गांव सेंटर आधुनिक मानसिक स्वास्थ्य सेवाएं उपलब्ध कराएगा, जिसमें वयस्कों, बच्चों, किशोरों और बुजुर्गों की साइकियाट्री, नशा मुक्ति और रिहैबिलिटेशन प्रोग्राम, न्यूरोमॉड्यूलेशन ट्रीटमेंट जैसे TMS और केटामाइन थेरेपी, साइकोलॉजिकल काउंसलिंग और साइकोमेट्रिक असेसमेंट शामिल है।
I am the founder chairman of Maarga Mind Care and People Tree Hospitals at Bengaluru. So we started Maarga Mind Care in Bangalore in the year 2016, and we had always had the vision, to make mental health care accessible throughout the length and breadth of our country. Yes, but it took time. We are here now in Gurugram. And yes, we are not going to stop here. This is just our first step. So we are going to go do this 25 to 30 centers across the Tier 1 and Tier 2 cities of India. And then yes, we have other plans for the smaller towns and rural areas also.
मैम, ये मार्गा माइंड केयर और सेंटर से कितना डिफरेंट है? जितने भी मेंटल सेंटर है उससे और कितना डिफरेंट है? इसमें क्या क्या चीज़ें हैं?
So how is it different? So we have everything required for any mental health need under one roof. So we have outpatient services. We even have online consultations if people cannot come to our hospital to attain to take some help. We have 24/7 emergencies and purely mental health emergency. We have something called as C2R services, like C2R, which is crisis to recovery. So what and beyond. So what does this mean? So there are some patients who are very violent, who are aggressive. They are troublesome to themselves, harmful. They can harm themselves. They have suicidal tendencies, or they are harmful to their immediate people around them. So we have a team who are trained as per the Mental Health Act of India to go to their place and then to talk to them, convince them, and then if required give some medication in very difficult cases, and then retrieve. It's called retrieval services. They retrieve them to our center, and then here our clinical team treats them, calms them down, make them they can at least start after 2-3 days. They can take therapies and counselling and all other treatment, and that's how we have a 24/7 emergency services and inpatient facility. We also have something called a psychiatric ICU, and under the treatment we have medical treatment, we have therapies, we have counselling sessions, we have something called holistic therapy, which includes dance therapy, music therapy, drama therapy, movement, yoga therapy, and the latest evidence-based neuromodulation. So neuromodulation is something called as TMS, that is transcranial magnetic stimulation. We have something called TDCS. We have something called the modern ECT, and we have something called VR therapy, the virtual reality therapy for phobias and for OCDs. So everything is available under one roof.
मैम, मेंटल पेशेंट्स जो होते हैं उनकी मेडिकेशन कितने लंबे टाइम पे होता है? मतलब 10-15 के साथ?
That my psychiatrist will decide. We have trained psychiatrists. We have psychiatrists who are trained and worked across the globe, from UK, from Australia, from who have been trained under great institutions like NIMHANS. So they decide who requires medication and when exactly they would require medication. Not everybody requires a medication, and if required medication, how long. And that's when the other treatment modalities come in place, like the neuromodulation, the counseling sessions, the therapies, different therapies we have. So once all these actually starts helping the patient, we get excellent outcomes, then the medications will actually come down. But it differs from patient to patient and condition to condition. That my clinical
I'm Dr.
team.
Girish Chandra. I'm the medical director with Maarga Mind Care. As you all know, accessibility and stigma have been the two biggest stumbling blocks, biggest hurdles with respect to mental health. So this venture, second hospital which we are starting, is addressing this particular issue. We how sort of what are the in what way we are different from others is that we want to focus mainly on the fundamentals regarding good care, good professionals with good skills and good experiences. And so we have our center which is working in Bangalore, which is extremely successful and basically known for good mental health care, really good basic mental health care, and that's exactly what we want to do in Gurugram. And we are very, very thankful that for all the media today to come here to take this message out to the public. Thank you very much. Good afternoon, everyone. Esteemed guests on the dais, my colleagues and friends, and esteemed members of press. It's with immense pride and humility today I stand before you as the Medical Director of Maarga Mind Care, our new branch here in Gurugram. In a world where physical health often takes precedence, mental well-being remains a critical and sometimes silent priority. Our mission at Maarga Mind Care has always been to provide a guiding path, that is Maarga, towards a holistic mental wellness. The inauguration of this new facility is more than just an expansion of our physical footprint. It's a testament to our unwavering commitment to making quality, compassionate, and mental health care accessible to the vibrant community of Gurugram. Within these walls, we have cultivated a safe, supportive, and confidential environment where healing begins and resilience is built. Our team of dedicated professionals is equipped with the expertise, empathy, evidence-based practices.
Dr. Ashutosh Raghuvanshi, who requires no introductions, with his excellent career in cardiac surgery, and he is the... I now hereby request our Executive Director, Dr. Upendra Kumar, to honor our sir with memento and bouquet. Thank you. Managing Director and Chairwoman of Maarga Mind Care and People Tree Hospitals. A first-generation entrepreneur, an obstetrician and gynecologist from Kadapa, Dr. Neeja built People Tree Hospitals brick by brick. Through relentless work.
To one and all. Namaste, Namaskar. So I'm here in Gurgaon today. Greetings to the people in Gurugram and a warm greetings on behalf of Team Maarga to our respected Chief Guest, Dr. M.K. Ramesh, President of Medical Assessment and Rating Board, National Medical Commission, and Dr. Ashutosh Raghuvanshi, sir. Thank you for coming. And my entire team here, Maarga team in Gurugram, and the members of the press and media, colleagues, my dear friends, and all the well-wishers who are present here today. It's an honor to welcome you to the launch of Maarga Mind Care in Gurugram. This is an initiative that has grown not merely from professional experience, but from years of witnessing the silent and unattended battles people fight behind closed doors. For years as a medical profession, I had realized that the reality is the emotional and psychological stories behind the physical problems lies unspoken. In my small hometown, I have seen families navigating trauma, grief, anxiety, depression, and fear, silently struggling behind closed doors. Years later, even while leading multi-speciality hospitals in Bengaluru, surrounded by hospitals with world-class infrastructure, advanced medical systems, and cutting-edge technologies, I continue to see the same silence. Despite receiving exceptional cardiac care, cancer care, and all other surgical and medical care and treatment, the psychological weight that the patients carry often remained unseen, unspoken, and untreated. As Abhishek just told, India today stands in the middle of a silent mental health emergency. We have a staggering 197 million Indians living with mental health problems and disorders, and this is the people who have come out into the open. There are still a lot more hidden under the carpet without coming out into the
Address
open.
the gathering and share his thoughts on the occasion.
So good afternoon, everybody. Dr. Raghumshi, Jyoti, Upendra, Girish, and other staff present here, and also my close friend son, Dr. Abhishek, his wife. This is a beautiful center. I'm at compliment. It looks like a PVR theatre. I'm at compliment Upendra, Jyoti, because when we were doing MBBS, the idea of mental ward was entirely different. The idea of a mental ward as well as a psychiatrist, entirely different, because we thought that whoever joined a psychiatry would also become a psychiatric patient. And I don't know why our process also looked like that only at the time. But over the year, the centers like this have come up, and nowadays most of the psychiatrists, they look like film models. That's how the metamorphosis are taking place. That said, actually, psychiatry is one of the most neglected aspects of mental health. In fact, it's good that government is also taking note of that, and it has foreign mental health authorities in all the states. In fact, in most of the states, it's been overseen by the high court judges. Because I have come from a rural background, have seen the problem of psychiatry. In fact, the possessed people, what we used to see at that time, we never knew that they were all psychiatric patients. In fact, we thought the ghost has possessed them, and have witnessed many instances where how brutally they try to get the possessed ghost or spirit away from the body. In fact, it looks like an entertainment to other people. In the village, it's very, very popular. Throughout the village, you'll be chasing it, that person will be running, and the arguers will be going behind it, taking the free entertainment. And it was very brutal, actually. Now, when I look back, I feel that at least if late than never, India is rising up to that. There's a good concept in Western countries. There is the concept of mental illness is there since a long time. It's known that most of the CEOs, they say, have regular psychologists with whom they take the counselling. I think that idea is coming up in India also. Mr. Raghumshi should be tell about it, whether it is true or not. That's what I have been hearing, and we have been hearing like that. So in that way, the Maarga has a good addition to it, and the sophisticated centers like this, with the professional caring, the stigma should be able to remove the stigma. Because in Bengaluru, the emergencies there, we never called an emergency, earlier it was also Uchaspathre.